Have you ever felt unusually thirsty in the middle of the night, gotten up to drink water, and thought nothing of it? Or maybe you've noticed your eyesight getting blurry every now and then, and blamed it on tiredness or aging. What if I told you that these small, seemingly harmless signs could be your body's way of screaming for help? After the age of 55, your body changes in ways that can quietly open the door to type 2 diabetes, and the scary part is, most people completely miss the warning signs until it's too late. Today, I'm going to walk you through the early symptoms of diabetes that almost everyone over 55 ignores, and by the end of this video, you'll know exactly what to watch for, what it means, and what you can do about it. Stay with me, because this information could genuinely change the way you take care of your health. Let's start with the most common one: increased thirst and frequent urination. Now you might think, well, I'm just drinking more water because it's hot, or maybe I had a salty meal. But here's the thing: when blood sugar levels rise, your kidneys work overtime trying to filter and absorb the excess glucose. When they can't keep up, that glucose ends up in your urine, pulling fluids from your tissues along with it. This leaves you dehydrated, which makes you thirstier, and the cycle continues. So if you're someone who's waking up 2 or 3 times a night to use the bathroom, or you find yourself constantly reaching for a water bottle without any real reason, this isn't just a minor inconvenience. It could be your body trying to flush out extra sugar that shouldn't be there in the first place. Next, let's talk about fatigue. Now I know what you're thinking. I'm over 55. Of course I'm tired. Everyone gets tired as they age, right? But there's a difference between normal tiredness after a long day and the kind of fatigue that doesn't go away no matter how much you rest. When your cells can't properly use glucose for energy because of insulin resistance, your body essentially starves at a cellular level, even though there's plenty of sugar floating around in your bloodstream. Think of it like having a truck full of fuel, but the fuel line is clogged so the engine can't get what it needs. That's what's happening inside your body. If you find yourself needing naps every afternoon, struggling to get through simple tasks, or just feeling drained even after a full night's sleep, this could be more than just getting older. It could be your blood sugar levels quietly climbing. Now, here's one that catches a lot of people off guard: blurry vision. Many people over 55 assume blurry vision is simply part of aging, and sure, sometimes it is. But did you know that high blood sugar can actually cause the lens of your eye to swell? This swelling changes the shape of the lens, and that affects your ability to focus, leading to blurry or fluctuating vision. The tricky part is that this kind of blurriness can come and go. One day your vision seems fine, and the next day everything looks slightly out of focus. If you've been to the eye doctor multiple times in a short period because your prescription keeps changing, that's a red flag worth paying attention to. Your eyes might be trying to tell you something that has nothing to do with simply needing new glasses. Let's move on to something that's often dismissed entirely: slow healing cuts and wounds. Picture this: you nick yourself while cooking, or you get a small scrape on your leg, and instead of healing within a few days like it used to, it takes weeks. Maybe it even gets a little infected before it finally closes up. High blood sugar levels affect blood circulation and can damage nerves over time, which means less blood flow reaches the site of an injury, and your immune system doesn't function as efficiently as it should. This is especially important for people over 55 because wound healing naturally slows with age anyway. So this symptom often gets brushed off as just part of getting older. But if you're noticing that cuts, bruises, or sores are taking significantly longer to heal than they used to, this is your body sending up a flare that shouldn't be ignored. Now, let's talk about something a little more uncomfortable to discuss, but incredibly important: tingling or numbness in your hands and feet. This is often one of the earliest signs of nerve damage caused by elevated blood sugar, a condition known as diabetic neuropathy. It might start subtly, like a pins and needles sensation in your toes after sitting for a while, or a strange numbness in your fingertips when you wake up in the morning. Many people brush this off as poor circulation, sitting wrong, or just sleeping on their arm. Funny, But if this tingling becomes a regular occurrence, especially in both feet or both hands, it's worth getting checked out. Nerve damage from diabetes can be progressive, meaning it tends to get worse over time if blood sugar levels aren't managed, so catching it early can make a significant difference. Here's another one that's easy to overlook: unexplained weight loss. Now, this might seem counterintuitive. Shouldn't diabetes cause weight gain? Well, in the early stages, especially when your body isn't using glucose properly, it starts breaking down fat and muscle for energy instead. This can lead to noticeable weight loss even if you haven't changed your diet or exercise routine at all. If you've recently dropped several pounds without trying, and you're not sure why, please don't just celebrate it as a happy accident. Talk to your doctor, because this could be a sign that your body is struggling internally. Let's also touch on something that affects quality of life significantly: increased hunger, even after eating. This might sound strange, but when your cells aren't getting the glucose they need due to insulin resistance, your body sends out hunger signals because, on a cellular level, it thinks it's starving. So you might eat a full meal and still feel hungry an hour later. This can create a frustrating cycle where you're eating more, but somehow still feeling unsatisfied. And this constant hunger combined with potential weight loss can be confusing and concerning if you don't know what's causing it. Now, let's talk about something many people associate with stress or anxiety, but it could also be tied to blood sugar imbalances, irritability, and mood changes. When your blood sugar levels spike and crash throughout the day, it can affect your mood in ways you might not connect to your diet or health at all. You might feel unusually irritable, anxious, or even experience brain fog where it's hard to concentrate or remember things. Family members might notice you seem more on edge than usual, or you might find yourself snapping at loved ones over small things. While this can certainly be related to other factors, when it's combined with some of the other symptoms we've discussed, it's worth considering blood sugar as a potential underlying cause. One more symptom that's particularly relevant for those over 55: recurring infections, especially yeast infections, urinary tract infections, or gum infections. High sugar levels in the blood and urine create an environment where bacteria and fungi thrive. So if you find yourself dealing with one infection after another, particularly in areas like the urinary tract, skin folds, or gums, and your doctor hasn't found another clear explanation, it's worth asking about blood sugar testing. So here's the big question: what should you do if you're noticing one or more of these symptoms? First, and most importantly, don't panic, but don't ignore it either. The best thing you can do is schedule an appointment with your doctor and ask for a simple blood test, specifically a fasting blood glucose test or an A1C test, which measures your average blood sugar levels over the past 2 to 3 months. These tests are quick, affordable, and can give you a clear picture of where you stand. Early detection is incredibly powerful when it comes to diabetes, because in many cases, especially in the pre-diabetes stage, lifestyle changes alone can reverse or significantly improve the situation. We're talking about things like adjusting your diet to reduce processed sugars and refined carbohydrates, incorporating more physical activity into your daily routine, even something as simple as a daily walk, managing stress levels, since stress hormones can raise blood sugar too, and getting quality sleep, because poor sleep has been directly linked to insulin resistance. I also want to address something important here. If you've been experiencing these symptoms for a while and you've been telling yourself it's just part of getting older, I want you to know that aging does bring changes, but it shouldn't mean accepting decline as inevitable without at least checking what's going on. Your body, at 55, 60, 65, and beyond, deserves the same attention and care as it did when you were younger, maybe even more so. You've earned the right to feel good, to have energy, to enjoy your life without constantly fighting fatigue or discomfort. So, to summarize everything we've covered today, pay attention to increased thirst and frequent urination, persistent fatigue that doesn't improve with rest, blurry or fluctuating vision, slow healing cuts and wounds, tingling or numbness in your hands and feet, unexplained weight loss, increased hunger even after eating, mood changes and irritability, and recurring infections. None of these symptoms alone definitively means you have diabetes, but if you're experiencing several of them together, especially if they're new or have gotten worse recently, it's worth having a conversation with your healthcare provider. I want to leave you with this thought. Your health after 55 isn't about fearing what could go wrong. It's about empowering yourself with knowledge so you can take action while you still have the most options available to you. Diabetes, when caught early, is manageable, and in many cases the progression can be slowed or even reversed with the right lifestyle adjustments. But the first step is awareness, and that's exactly what you've gained by watching this video today. If you found this information helpful, do me a favor and share it with someone you care about, maybe a parent, a sibling, a friend, or even yourself if you've been putting off that doctor's visit you know you need to schedule. Sometimes the people who need to hear this information the most are the ones who are too busy taking care of everyone else to stop and think about their own health. Make sure to subscribe so you don't miss future videos where we'll continue exploring practical, easy-to-understand health information that can genuinely make a difference in your quality of life as you age. And remember, taking care of your health isn't selfish. It's necessary, because the people who love you need you around, healthy and thriving, for many more years to come. Until next time, take care of yourselves, listen to your body, and don't ignore the whispers before they become shouts. See you in the next video.